Hello, and welcome to the New Mexico Lay Vaccinator training. This presentation is designed to supplement hands-on rabies vaccination training. If you're taking this module online, please consult the New Mexico Lay Vaccinator program guide for instructions on how to complete appropriate hands-on training, or contact your local Indian Health Service representative for information. We'll begin by learning about the rabies virus and the disease it causes. Our objectives for the first part of this training are to prepare you to explain rabies as a disease and recognize its importance, discuss the occurrence of rabies in the U.S. and New Mexico, recognize how rabies is transmitted, and describe how to prevent rabies. Rabies is caused by a virus. The virus can infect all warm-blooded mammals, including humans. Rabies is a zoonotic disease, meaning the disease can be passed directly from infected animals to humans. Humans and animals get rabies when they are bitten by an infected animal. The virus travels in the nerves to the salivary glands and is transmitted through the saliva to the bite victim. There is no virus in the blood, so there is no blood test for rabies. The incubation period of rabies, which is the time for signs of the disease to develop, is widely variable and ranges from a few weeks to as long as a year. For both humans and animals, there are no blood tests to diagnose rabies before symptoms appear, and once symptoms occur, the disease is nearly 100% fatal. Rabies is an important public health issue across the globe. Dog bites are responsible for 99% of human rabies cases worldwide. Rabies is a disease that can be prevented with vaccine, and yet every 10 minutes, someone somewhere in the world dies of rabies virus infection. Rabies is the deadliest disease on Earth. Most rabies deaths occur in developing regions within Asia and Africa. However, as we'll discuss later, Americans also die of rabies infection. Hundreds of thousands of animals also die each year from rabies. Infected wildlife most often cause rabies exposure in pet dogs, which then expose humans. Most human rabies exposures in developing regions are from dog bites, and the majority of dog bite victims are children under 15 years of age. In the United States and Canada, rabies eradication efforts have been successful in ridding both countries of the canine form of rabies through vaccination of dogs. However, dogs and cats can still contract other strains of rabies virus from wild animals and then spread these strains to humans. Research and eradication efforts have proven that rabies vaccination of pets creates a protective barrier between humans and wildlife and is the best way to control rabies infection in humans. The physical symptoms of rabies in animals vary greatly, making it very difficult to tell what a rabid animal looks like even after the virus has reached the brain. Although there is no typical symptoms of rabies, suspicion should be high when any wild or domestic animal is acting strangely. For instance, any wild animal that is involved in human interaction when its normal behavior would be to avoid people. This includes a wild animal being out and about during the wrong time of day, or any wild animal that is acting tame. Because it's rarely possible to tell if an animal is rabid by looking at it, almost all bites by wild animals are considered a rabies risk. Domestic animals are often described as having one of two types of rabies symptoms, the furious form or the paralytic form. The furious form is the well-known image of rabies. The furious form is also referred to as the classic form or mad dog syndrome. Infected animals lose caution and fear of people and other animals. Animals with this form of rabies frequently foam at the mouth, attacking other animals, people, and any moving object. Dogs suffering from the furious form of rabies may chew the wire and frame of their cages. They may bite at the air, at moving objects, or themselves. Young puppies that are infected sometimes seek human companionship and affection, but usually become vicious within a few hours. Some animals may suffer from the paralytic form of rabies. This form is often characterized by stumbling and incoordination and other unusual behavior and body positions. Paralysis progresses rapidly to all parts of the body and eventually results in death. The paralytic form is also called the dumb form because it may include paralysis of the throat and jaw muscles, profuse salivation, and the inability to swallow. Because of the effect of the disease on the throat and mouth, rabid animals and humans sometimes are not able to vocalize normally. This has led to the alternative name of dumb form, meaning unable to speak. In the past, rabies was called hydrophobia, or fear of water, because human victims frantically pushed away offers of water, knowing they would choke on it. This is a video of a dog in the early stages of rabies. This dog was taken to a New Mexico animal shelter for adoption in 2013. One of the shelter workers took this video before the dog was euthanized. The dog's brain was tested for rabies and found to be infected. Although rabies is rare in the United States, this case demonstrates that rabies is far from being a disease of the past. Any animal suspected of having rabies must be managed carefully to prevent exposure to humans or other animals. Wild animals should be observed from the distance and reported to wildlife authorities. Domestic animals should be confined away from humans and other animals and examined by a veterinarian. Rabies infection is extremely rare in properly vaccinated animals. However, no vaccine is 100% effective. Any suspicion of rabies in an animal should be reported to public health officials and your IHS vaccine program representative. In the event of rabies in an animal or exposure of a human on tribal land, the New Mexico Department of Health will steer an investigation in conjunction with tribal officials and the Indian Health Service. As the video of the shelter dog showed, rabies does exist in the United States and in New Mexico, and vaccination efforts in companion animals are an important preventive measure. In the United States, the most common wildlife species to contract rabies are the raccoon, skunk, fox, bat, and mongoose. This map from the Centers for Disease Control and Prevention shows the distribution of rabies in terrestrial mammals in the United States and Puerto Rico from 2008 to 2015. Bats are also mammals that can contract and transmit rabies. This map shows the distribution of bat rabies in the U.S. Each wildlife species shown on these maps has a specific form or strain of the rabies virus. While each rabies virus strain is most common among the originating species, they can be transmitted to any other mammalian species, including humans. In New Mexico, the most common rabies strains are bat, fox, and skunk strains. Before 2009, the United States also had the canine rabies strain. In 2009, the canine strain was declared eradicated in the US and Canada. All cases of canine rabies since that time have been in dogs infected with a wildlife rabies strain. This graphic summarizes cases of actual rabies disease in humans in the US and Puerto Rico from 2008 through 2017. Each case is described by the circumstances of the exposure and the rabies virus strain identified in the victim. Most cases of human rabies in the U.S. are caused by bats. The victims who died of rabies caused by dogs were infected while traveling outside the U.S. Although there are many exposures to rabies each year, there have been no cases of rabies disease in a human in New Mexico since 1956, when a victim was bitten by a rabid dog. Since that time, early recognition and post-exposure medical treatment provided to victims bitten by rabid animals has stopped the virus from traveling to the brain and causing disease and death. Though it has been many decades since the last case of human rabies in New Mexico, rabies is still circulating in wildlife in the state. Without continued diligence in vaccinating our companion animals, the protective barrier preventing human cases in New Mexico could fail. Although all mammals can become infected with rabies virus, the New Mexico Department of Health lists several high-risk wildlife species. In recent years, the most common rabies-positive species in the state have been bats, foxes, skunks, coyotes, and raccoons. Other wild mammals, such as rodents and rabbits, present a lower or even minimal risk. In New Mexico, most domestic animals are also considered lower risk, although many domestic animals have tested positive for rabies. The number of confirmed cases of animal rabies in New Mexico varies greatly from year to year. In 2017, there were 11 cases, while in 2012, there were 48. As previously mentioned, rabies virus has numerous strains. Each rabies virus identified is genetically mapped. In 2015, a never-before-seen form emerged in New Mexico. This new rabies strain was identified from a rabid fox that bit a woman in Lincoln County. The fact that there remains information to be learned about the rabies virus highlights the importance of continued vigilance in vaccine and other prevention programs. Additional information pertaining to the public health impact of rabies globally can be found at the website funded by the Global Alliance for Rabies Control. This organization was founded on their mission to prevent human deaths from rabies and relieve the burden of rabies in other animal populations, especially dogs. The Alliance has 2 excellent training programs, an Animal Handling and Vaccination Certificate program, and a Rabies Educator Certificate, for lay vaccinators interested in continuing their education about the control of rabies. Their website is included in the information packet.